is Chicago's very own WGN News.
A new study published by researchers at the University of Illinois found the stress of living in a violent neighborhood can impact aggressive lung cancer tumors. That was just published in the journal Cancer Research Communication. An associate professor of food science and human nutrition, Zeynep Madak Erdogan, is joining us now. Professor, this is both fascinating and very troubling here. Tell us what specifically you set out to learn and how did you go about doing it?
Yeah, I have a great collaborator at University of Illinois, Chicago, Dr. Sage Kemp. She's an epidemiologist, and in her previous studies, she found that lung cancer incidence was higher for particularly Black males who live in high violence neighborhoods. So our study was a follow-up to that, and we wanted to understand the molecular basis, how our body senses the stress and how it translates into worst outcomes in terms of lung cancer in this population.
So I understand you did this over a period of 2 years. Was this specific to Chicago? Where did you focus your study here?
Yes, our study focused on Chicago. The samples that we analyzed were from different zip codes through city of Chicago, and we really looked at the relationship between molecular characteristic of these tumors and the neighborhood violence characteristics.
So as I read through that study and tried to grapple with it here, it's about the stress hormones. But what about the other factors like access to health care? How did you account for things like that in the study?
Yeah, in the previous study that I mentioned, Dr. Sage Kemp, she looked at some of these other neighborhood factors, for example, the air pollution in the neighborhood, as well as the composition in terms of racial and ethnic composition of those neighborhoods, and other factors like access, as you mentioned. And to our surprise, it was really the neighborhood violence that seemed to have a correlation with the lung cancer incidence in this case. And, our follow-up study actually validated these findings, and we found the molecular links, in a way, molecular signatures in these tumors.
I'm sure you can't really explain it in the short context of this interview, how you were able to isolate it to just the stress here. That is one thing, but were you also surprised that it led to this specific kind of cancer as opposed to other diseases?
Yes, that was the other surprising thing, because we also worked in the same area and looked at some of the factors that were related to breast cancer before. And in that case, our findings really pointed out exposure to environmental toxicants rather than the neighborhood, violence in that case. So there seems to be a very disease-specific trigger in those environments, and it can be, in this case, neighborhood violence for lung cancer and other, environmental toxicants for breast cancer.
So it sounds like it did surprise you. It sounds like really groundbreaking work. Tell us what you do with this study and how do you anticipate it might affect health policy, maybe here in Chicago and then hopefully nationwide.
Yeah, there are several implications related to these findings. The first one is the screening guidelines. The current guidelines are really, geared towards smoking and certain age groups. And we feel that the neighborhood should be also taken into account as the individuals are selected for lung cancer screening. And also, obviously, reducing neighborhood violence is the other thing to really prevent this particular disease, as well as other potential, health adverse effects.
U of I professor Zeynep Madak Erdogan, thank you so much for joining us and sharing the results of your study with us. We appreciate it.
Thank you.